Dr. Sandoval, I could really use your help with this one. I've been puzzling over it for a bit, and I just can't seem to get my head around it. The problem states, a patient is on methadone maintenance therapy with a prescription of 15 milligrams per day orally. The medication is supplied as 10 milligrams in 5 milliliters oral solution. How many milliliters should the patient take each day?
Fair enough, Priya. This problem packs a lot into one sentence, and it's easy to mix up what quantity relates to what, potentially leading to an incorrect dose. Let's slow it down and pull it apart. First, what are the key pieces of information the problem gives us, and what is it ultimately asking us to calculate?
Okay, so the patient needs 15 milligrams per day of methadone. That's the prescription. The medication comes as 10 milligrams in 5 milliliters of oral solution, and the question is asking us to find out how many milliliters the patient should take each day.
Excellent, Priya. You've clearly laid out all the given information and what the problem is asking for. We have the desired dose and the available concentration of the solution. Now, before we calculate the final volume, let's think about that concentration. The medication is supplied as 10 milligrams in 5 milliliters. How can we express that as a concentration in milligrams per milliliter?
Okay. If it's 10 milligrams in 5 milliliters to get milligrams per milliliter, I think I need to divide the 5 milliliters by the 10 milligrams. So that would be 0.5 milliliters per milligram. Is that the right way to set it up?
You're on the right track with using division, Priya, but you've inverted the ratio. Concentration tells us how much drug is present per unit volume, so we usually want milligrams per milliliter. Right now, your calculation gives us milliliters per milligram. Think about what quantity belongs on top to get milligrams per milliliter. Can you try setting up that division again?
Oh, I see. Milligrams per milliliter means the milligrams should be on top, so it should be 10 milligrams divided by 5 milliliters. That would give me 2 milligrams per milliliter. Is that the correct concentration?
Yes, that's exactly right, Priya. 10 milligrams divided by 5 milliliters gives us 2 milligrams per milliliter. This is the correct concentration of the methadone solution. Now that we know the concentration and the prescribed dose, what's the next step to figure out how many milliliters the patient should take each day?
Okay, so we have 15 milligrams per day prescribed, and the solution is 2 milligrams per milliliter. I think I need to divide the concentration by the desired dose to find the milliliters. So, 2 milligrams per milliliter divided by 15 milligrams per day. That would be about 0.133 milliliters per day, right?
You have the two right numbers, Priya, but they're upside down again. You want to find how many milliliters you need, and you have 15 milligrams that you need to give. Each milliliter only contains 2 milligrams. So if you divide 2 milligrams per milliliter by 15 milligrams per day, your units don't cancel out to give you milliliters per day. Think about how to set up the division so that milligrams cancel out and you are left with just milliliters per day. The question is, how many lots of 2 milligrams are in the 15 milligrams you need to give? Try that division again.
Oh, I keep mixing that up. Okay, so I need 15 milligrams, and I know there are 2 milligrams in every milliliter. So if I divide 15 milligrams per day by 2 milligrams per milliliter, that should give me 7.5 milliliters per day. Is that finally it?
Yes, that's absolutely it, Priya. 15 milligrams per day divided by 2 milligrams per milliliter correctly gives you 7.5 milliliters per day. Congratulations, you've solved the problem. To summarize, we first calculated the concentration of the solution, then used that concentration and the prescribed dose to determine the exact volume needed each day.
Oh, thank goodness. That makes so much more sense now. I definitely kept getting those ratios mixed up. Thanks so much for guiding me through it, Dr. Sandoval.